which is the children and young people's views. Their views actually can overall be summed up perhaps by the words of Professor Turner, when he said, "I think that the message I will be keen to get across is that there was, before the pandemic, during the pandemic, and after the pandemic, there's not been equity. Children are not treated equally in our society. It's a defining characteristic against which we should not prejudice, but children do not get the best in this country. 25% of the population, and they get 11% of the NHS spend, and they rarely ever seem to feature in decision-making." But let's use the children's own words. So Elodie, who was 10 years old at the start of the pandemic, and who, my lady, you heard when I had my opening submissions, the inquiry has provided unequivocal responses to the first 4 questions. We have been answered in the most hurtful manner possible. We as children realize that we were simply not considered individually or even as a group in decision-making. No proper consultation was carried out in relation to the entirely foreseeable impact of the closure of schools. It is shocking that the Children's Commissioner did not even get a seat at the table to advocate for or to protect me and the countless others who were adversely affected. There is not one child who hasn't been affected, and the mid to long-term impacts of COVID are a generational guessing game. Mental health issues such as anxiety and depression affecting young adults and children have risen, and school attendance has fallen. The entirely reactive approach taken has led to a diminution in the fundamental respect for education and schooling in Northern Ireland. These are outcomes that will spill over into our adulthood and futures. Hope only can be found through genuine responses to our final 2 questions. It's my wish that steps are taken to immediately and robustly assess the current impacts of COVID on all young people, and for the government to respond swiftly and decisively to attempt to mitigate against the damage that they have done. Our voices need to be represented at a national level with a dedicated Children's Commissioner. I do believe in the power of rights and laws to protect us. The UNCRC must now immediately be enshrined in our domestic law to protect us in the future. That would not be a fairy tale ending, as the spectre of COVID remains a reality, but it would give hope to us as young people of Northern Ireland, and that we have been seen, if not also heard. Seren, 13 years at the start of the pandemic. I have been left with more questions than answers. The evidence provided showed an executive unprepared. Officials were not psychologically or physically prepared, and reacting seems to have become the way the pandemic was then handled going forward. Sadly, it doesn't seem like there have been any lessons learned for now or the future. And according to Derek Baker's written statement, there have been no formal lessons learned exercises commissioned. There seems to have been a lot of focus in the inquiry on education attainment, less said about the well-being of students. There should have been, and still needs to be, a focus on the mental health of young people. We have been poorly informed of the risks of COVID infection and how airborne infections spread. Everyone, especially schools, should be given appropriate advice. The government should also be prepared for all types of pandemics and provide leadership. This module hasn't adequately considered how failing to make schools, healthcare and public spaces safer has impacted children. My sister Molly was 8 at the start of the pandemic and is now 13 and still extremely vulnerable. Outside of my family, who's protecting her? Nikki, not her real name, 13 years old at the start of the pandemic. An issue I don't feel was particularly addressed that should have been was children and young people's voices not being heard and not being particularly considered in decision-making. One effective step I believe should be taken to help ensure children's best interests are at the heart of future decision-making is the incorporation of the UNCRC into domestic law in England and Northern Ireland, as has already been done in Scotland. So, my lady, to conclude, the evidence is replete with the right questions having been recognised, albeit often reframed, but when one looks for the answer, the evidence often seems to lose focus and dribbles away, lost in qualifications, irrelevant explanations, and bureaucratic speech that says much but conveys little. Often at the end of it all, you're not particularly any the wiser. There's some flat denials, some don't knows, not the right person, I'll have to get back to you. And all of that is extremely hard for children and young people to take, who believed, with the focus of the module being on them, and given that we are now 5 years away from the pandemic, that they would finally get proper answers and perhaps even apologies. Yet they are left without that, and a feeling that no one has taken responsibility or is likely to be held accountable for the harm inflicted on them, which in many cases was intentional harm, at least knowing that it would cause harm. More importantly, without the comfort of knowing that should there be another pandemic, their experience or those of their loved ones would be markedly any better. Again, they look to the report on this module to provide the information they lack. And in terms of going forward, they look to the inquiry to make recommendations to provide some measure of reassurance for the future. Thank you very much, my lady.
Thank you, Ms. Anyadike-Danes.